If you are over 60, you stopped adding salt, you read every label, and your blood pressure is still higher than your doctor wants, do not make the mistake of thinking you have failed. And do not make the opposite mistake either, assuming salt never mattered. The truth is more useful than either extreme. Sodium can raise blood pressure, but blood pressure is rarely controlled by one food, one mineral, or one habit. After 60, your kidneys, blood vessels, hormones, sleep, medications, activity level, and overall eating pattern can all affect the numbers on the monitor. So in this video, we are going to look beyond the salt shaker. We will cover several common reasons blood pressure may remain elevated, the food changes that may support better control, the warning signs that should never be handled at home, and the questions worth taking to your next medical appointment. This is general education, not a diagnosis or a replacement for medical care. Do not stop, reduce, or change blood pressure medicine without speaking with the clinician who prescribed it. Now let us start with the question many older adults quietly ask. I cut the salt. Why are my numbers still high? First, because sodium is only one part of the system. When you eat a high-sodium meal, your body may retain more water. That can increase the amount of fluid moving through your blood vessels and push pressure upward. Your kidneys normally help regulate this balance by removing sodium and water through urine. But people do not all respond to sodium in the same way. Age, kidney function, genetics, medications, diabetes, body weight, and other health conditions can change how strongly your blood pressure reacts. That means two people can eat the same meal and see different results. One person may barely notice a change. Another may see swelling, thirst, or a higher reading the next morning. This does not make sodium irrelevant. It means that cutting sodium alone may not be enough. And before you change your diet again, there is one step that many people skip. Make sure the number you are trying to fix is accurate. A blood pressure reading is a snapshot, not a complete diagnosis. A cuff that is too small, talking during the measurement, sitting with your feet unsupported, checking immediately after walking, drinking coffee, or feeling anxious can all distort the result. Use a validated upper arm monitor if possible. Sit quietly for a few minutes. Keep your back supported, your feet flat, and your arm resting near heart level. Take more than one reading and write them down. Your doctor needs a pattern, not one alarming number from a stressful afternoon. For many people over 60, this simple home log becomes one of the most valuable tools in the entire treatment plan. Now let us move to the first issue that is often missed, the balance between sodium and potassium. Most conversations focus on what to remove. Less attention is given to what may be missing. Potassium is a mineral found naturally in many whole foods. It supports normal nerve, muscle, heart, and kidney function. A food pattern that is high in sodium and low in potassium is generally less favorable for blood pressure control than one built around vegetables, beans, fruit, and other minimally processed foods. Good food sources include beans, lentils, potatoes, sweet potatoes, tomatoes, leafy greens, yogurt, and certain fruits. These foods also bring fiber and other nutrients that a supplement does not automatically provide. But there is an important warning here. More potassium is not safe for everyone. If you have kidney disease, reduced kidney function, or take medicines that can raise potassium, suddenly increasing potassium or using potassium supplements may be dangerous. Even salt substitutes can contain large amounts of potassium. So the safe message is not, take potassium. The safe message is, ask whether potassium-rich foods are appropriate for your kidney function and medication list. That distinction matters. The second issue is your overall carbohydrate and sugar pattern. This is where many people get distracted by arguments about whether sugar directly causes high blood pressure. The more practical point is simpler. A diet heavy in sweetened drinks, desserts, refined bread, pastries, and highly processed snacks can make it harder to control weight, blood sugar, triglycerides, appetite, and metabolic health. Those problems often travel with high blood pressure. For someone over 60, sweet drinks are a particularly easy place to begin because they add a large amount of sugar without making you feel full. You do not need to fear every piece of fruit or remove every carbohydrate. That is an unnecessary extreme. Start with the obvious sources: soda, sweet tea, energy drinks, heavily sweetened coffee, frequent juice, candy, cakes, and packaged snacks.